just another thank you to our many sponsors for today. This is absolutely would not be possible without the help and support of all of our sponsors, as well as the about 40 people who helped with our planning crew and our 2 conference planning team co-chairs, Teresita Hammond from Centera, amazing. And I'm trying to find Deborah Carlos from the Up Center. I'm not seeing her. Deb in here? Okay, she might have scooted, or she might be out in the hall, but they have done an amazing job of wrangling all of this together for you guys. So thank you guys so much. Also wanted to recognize Rachel Hunley, who has been an amazing support to the team and taking a lead in all the conference stuff. It's been a really gigantic help to us. So again, kind of everything sort of takes a village sometimes, and so does this. So a couple things I wanted just to point out really quickly before we go to this presentation, just in case some of you guys scoot, is 2 things in the back of your conference guide. One is the Earth app. So one of the action plan items, if you actually go to the page with the letter from your BEMA chairs here, or the description of the BEMA chairs, there's a QR code that takes you to our Black Maternal Health Equity Action Alliance site. And it will take you, if you scroll all the way to the bottom, you can see our action plan, and you can read about everything that we're doing, and you can pick an action team. In the back of the guide, this is the work of some of our other action teams. So our conference planning team has been busy at work planning this. We have a team that's working on the Earth app. So Earth is basically birth without the B for bias. It's basically Yelp for Black families to find safe maternal care. It is not being used in our area, and we're partnering with the makers of this app to expand it here. And then the other thing, this blue document here, is a new project that actually Beth Parker, there she is over there, is the action team lead for this one, is the roadmap to safe, equitable Black maternal care and birth. And so we are soft launching for feedback the first 2 chapters of this. This is a guide for families to help to figure out what to do if they feel like they've been mistreated, or they need to have a hard conversation with their physician. It just really helps to walk them through a safe birthing journey for a Black family. So we ask that you take a moment to go to those QR codes, review the roadmap, evaluate the roadmap, give us feedback on it. Please sign up for the Earth app if you are, if that's appropriate for you as a family, if you're still in the birthing years. Some of us have older kids. But those are just 2 projects. And then we also have our Voices survey project. So down at the cinch table, you probably saw another flyer that talked about a survey for families that have given birth in Hampton Roads in the last 3 years. We've done interviews with families, and we're also surveying families about their birthing experiences and journey, which will help to guide and influence this work. So I just lay that out for you guys. Please be participatory. And if you're not part of one of our working groups, Teresita or Beth or any of the other people, DeShonda, we'll be glad to have you be part of their work. We also have action teams around provider interactions and implicit bias and things like that. So again, would love to have you involved. So I'm going to ask Dee to come on up and do our introductions for our next talk.
Good afternoon, everyone. We made it. Thank you so much for sticking with us until the very end. We truly appreciate it. So my name is Diaviana Black. I go by D. I am a Master's of Public Health student at Florida A&M University and a practicum student, yes, and a practicum student with Cinch, EVMS. Welcome back to our gathering session, Creating the Village for Black Birth Safety and Empowerment. In this session, we'll dive into how we can move from meaningful dialogue to actionable strategies in protecting Black maternal health. Our powerful panel will share valuable insight and a clear vision on how to build a strong, supportive community for Black birthing individuals. I'm honored to introduce our esteemed speakers who are leading the important work and will help guide us through the next steps in creating a safer and more empowering environment for Black birth. First, we welcome Iris Lundy, Vice President of Health Equity at Centera Health. Iris is a decorated Army veteran, cancer survivor, and a national leader in equitable health access. Her work has reshaped health equity strategy through advocacy, community engagement, and cultural humility. She is a 2023 graduate of the Disparities Leadership Program at MGH, and a recipient of the AHA and VCIC Humanitarian Awards. Next, we are joined by Hamilton Holloway, the Communications and Policy Director for Families Forward in Virginia. With a rich background in public communication, Hamilton leads statewide messages across family health programs and previously served with Capital One and the Federal Reserve. He brings deep expertise in policy advocacy and strategic communication to today's conversation. Dr. Lindsay Robbins is an assistant professor of OBGYN, and the director of the Center of Maternal and Child Health Equity and Advocacy at EVMS. She specializes in high-risk pregnancies and it's been a long day. Sorry, y'all. And obstetrics, And her national policy work has shaped maternal mortality review standards. She is a leader, a researcher, and a passionate advocate for health equity. And last but certainly not least, we have Senator Dr. Mamie Locke, serving the Virginia State Senate since 2004. She's a political powerhouse, educator, and social justice advocate. Senator Locke has been a fierce voice for civil rights and equity, leading efforts to create systemic changes across education and public policy. We are honored to have her wisdom and leadership in this space. Please join me in welcoming all of our panelists for this afternoon.
Thank you, Dee. So I'm Beth Parker, and I'm going to be your facilitator for this last and final, but probably the best presentation. So thank you all for sticking with us. And as Dee, so I'm the Associate Director of Minus 9 to 5, which is at Virginia Health Sciences at ODU, formerly EVMS. And Minus 9 to 5 is an early childhood initiative. It's a collective impact. And our goal, we strive to make every family and all children in Hampton Roads equipped to raise children who are healthy, thriving, and ready to learn. So I think it's safe to say that we all agree that it really does start with the -9 months of pregnancy with a healthy mother who has access to prenatal care and safe and supportive pathways through pregnancy. I just want to say that it's been such an honor so far to work with Cinch and all the other partners who have put this conference together and on the roadmap and all the other pieces of this alliance. Everyone has worked so hard, and I really feel humbled to be a part of this and be a part of so many strong women and men who are fighting for equality and for justice for women, especially women of color. So let's give ourselves a round of applause for that. So this panel brings together voices that are dedicated to improving birth outcomes and ensuring that Black families are seen, that they're heard, and they're supported throughout their birthing journey. And together today, we're going to explore how strong communication, community partnerships, and advocacy can lead to safer and more equitable birth experiences. We hope that today the discussion will empower everyone here with tools to speak up for yourselves, for your clients, for your patients, for your loved ones, and to build stronger relationships with your healthcare providers and understand how policies shape access to care. We'll also highlight the critical roles that doulas, family members, community organizations play in uplifting and advocating for Black families. This is more than just a conversation. It's a step towards lasting change and collective empowerment. So we're going to get started, and we are going to hear first from Senator Locke. She has some slides that she's prepared, and we're thankful for that because she's got lots of knowledge around the policy and laws that she'll share with us, and then we'll open it up to the panel discussion.
Thank you, thank you. You all assume I know what I'm doing up here. Good afternoon. I'm going to run through these fairly quickly because I want to get to our question and answer session to talk about these issues. I'm going to talk to you very briefly about what happened in this last General Assembly session as we ran through our Momnibus package. And just very quickly, why does Black maternal health matter? Because every 7 seconds, a woman or newborn dies or a baby is lost to stillbirth, and this is preventable. And so we're going to talk, I know our panelists here, about why this is preventable. So this last General Assembly session, we put together a package of about 15 bills that we call the Momnibus bills of laws and policies that we thought were very important to pass in this session through the House and the Senate. I'm not going to go through all of them, but those that we actually got through and got to the governor's desk. Senate Bill 1352 and was also a House companion bill, House Bill 1635, dealt with certified midwives and licensed certified midwives. This bill particularly just allows the licensed certified midwives who have gained 1,000 hours of supervised practice would be allowed to practice independently once signed off by their supervisor. It requires the Department of Health to amend regulations to include other practitioners to be a part of organized medical staff. The bill was actually signed by the governor and will go into effect July 1. So you can applaud that. There's some other stuff he did. Okay. House Bill 1923 has to do with health insurance reimbursement for services rendered by certain practitioners. This bill would require health insurers to cover and reimburse licensed certified midwives and licensed midwives at the same rate as certified nurse midwives for the same services if the services are covered and legally allowed. The governor kind of changed this one to serve his purposes. Don't worry about it. The House rejected the governor's amendments. And interestingly, it takes a lot to get Republicans on board with Democrats. We have a very slim majority in the House of 51 to 49. And so that's not veto proof because it takes 2/3 to override a governor's veto. And the way that things work in the General Assembly is the House gets the bills first, and if whatever they do to the bills determines whether or not the Senate will see them. So we told them very early on, it's good with us if you never send them to us. We good. This is one we didn't get because they rejected the governor's amendments, and the bill is now waiting for the governor to make a determination of what he's going to do with it. The good part about this is they got enough Republicans to agree with them that it is veto proof. So even if the governor vetoes it, they can override the veto. And that's because many of our Republican friends realize that in the rural area parts of the state, they need these midwives, so that it is critically important that they understand that this is important to them as much as it is for those of us who live in urban and suburban areas. So this bill would be veto-proof, even if he vetoes it. So HB 1976 deals with high-risk pregnant patients and remote patient monitoring services. It requires Medicaid to cover remote patient monitoring for high-risk pregnancies, including pregnant patients and maternal diabetes and maternal hypertension. This one was signed by the governor and goes into effect July 1. So these next bills, I will run through fairly quickly. HB 1929, the House passed by for the day. What that basically means is they didn't like the governor's amendments. And when you pass a bill by for the day, it simply means that we don't like what you did. So we're going to pass it by the way that we passed it in the first place. So you decide what you want to do with it. And so it deals with pregnancy mobile application, promoting awareness of government maternal and infant health programs, which was fairly simple. This wasn't anything extraordinary, and he made some amendments to it that the House didn't like. So they, fine, we don't like your amendments. We're not going to take your amendments. We're going to send it back to you the way that we passed it in the first place. So you decide if you want to take it the way we passed it in the first place, or you can veto it. And House Bill 2109 is a task force on maternal health data and quality measures. This actually existed prior to the governor coming into office. And the only thing this bill would have done was to reestablish that task force to collect this data and to print it every year to let folks know what was going on in this world. The governor decided he didn't like it and created his own task force that does nothing. And so he made some changes to this bill. Again, the House decided, we don't like your amendments. We're going to pass this one by for the day too. So the only thing you can decide is you either pass it the way, you sign it the way we passed it to you, or veto it. Make a decision. Senate Bill 1418 dealt with postpartum doula care. It directs DMAS to amend the state plan to include a prescription for payment for up to 10 doula visits, 4 during pregnancy and up to 12 months postpartum. The Senate rejected the governor's amendments. And we're waiting for Senate action, for the governor's actions. Now, this was actually studied by the healthcare system as to whether or not this was doable. And they said, yes, it is. So that's why the bill was introduced in the first place. So he made some amendments to it that the Senate didn't like. And said, so we rejected the amendments and said, you either sign it the way we sent it to you, or veto it. Unfortunately, in the Senate, we don't have a veto proof. But our Republican senators said, if you reject the amendments, we will agree with you. So all 40 of us rejected the amendments. So they didn't like it either. Now, Catherine Haynes over here, wave your hand, Kat. We've been working on this for years. Senate Bill 270. And who was talking about this in the last session? You were talking about this in the last session. You didn't know you were talking about this, and I was going to talk about it. I've been carrying this legislation for a minute now. It directs the Board of Medicine to require unconscious bias and cultural competency training as a part of the continuing education requirements for licensure for health professionals. Now, it must be okay, legislation, if my chief co-patron is a conservative Republican from Southwest Virginia. That was my chief co-patron on this bill. And the bill passed with bipartisan support in both the House and the Senate, saying that, yeah, we need this. And it requires the Board of Medicine to report on the training to the Department of Health and Virginia Neonatal Perinatal Collaborative to say, yeah, this is something good. We do need this. Because we do know that there is bias And we do need the cultural competency that we have, and there have been studies done to show that this is indeed a problem. So, Governor, please sign the bill. He amended it to say, no, we don't need all this. All we need is a 2-hour video for people to watch, and that'll be good. So, in my statements on the floor, I said, Governor, I don't think so. A 2-hour video isn't going to cut it. Because if you can say that there's bias in what one can do for drug abuse, which you have done and stood up for, then I want you to stand up and say that there's bias in this area too. So I rejected his amendments, and there was still bipartisan support for rejecting his amendments, and I sent it back to him. I said, you either sign it or you can veto it. Either one. But I'm not going to allow you to insult me with your 2-hour video training. Senate Bill 1120 and House Bill 2617 establishes the Commission on Women's Health as a permanent commission in the legislative body. And this commission will study and make recommendations on women's and maternal health issues. He also amended this, and there was actually $500,000 put in the budget to support this commission. And interestingly, I don't think he did anything with the money. He just amended the bill, which was stupid. But we passed it by for the day. So Governor, either accept it the way we sent it to you or veto it. One or the other. So he has until May 2nd to adopt whatever changes that were made to the budget. You either adopt the budget we sent to you in February or veto it. That's what you have on your plate. You accept what we have said to you, or you can't make any more changes. You can't make any more changes. We told you what we want. Do it or veto. The whole budget. There's no more line item stuff going on here. So I'll stop there because the other things that we can talk about as we move forward about advocacy and so forth.
Thank you, Senator. I'd like to invite our other panelists up, and we're glad to know where you stand because we hear you. Thank you for your advocacy. And I think it's great that there's so many bills that are addressing these issues. So that's saying something. People are paying attention. All right. So we're going to just roll it back and start with sort of an open, whoever wants to answer. Very simply, why is advocacy important for improving Black maternal health outcomes? Why is it so important that we advocate? And it's open for anyone. Don't be shy.
I think that, so hi, first of all, thanks everybody for today. I feel like I've learned more from you than I can possibly offer in the next hour. So thanks everyone. I think advocacy is important because if we don't advocate, nothing will change. Change only happens if we put great energy and time into it. And another name for that energy and time is advocacy. And I think it's important because things can't stay the way they are, right? The new CDC data showed that maternal mortality rates dropped this year. I started reading the report and our rate started going up. I was like, oh, we're doing it, we're doing it. And then I saw that the disparity increased. I said, God, still there. And it's so disheartening to see that number stay the same year over year, but I think that we can change it through advocacy, and we have to in a country with this many resources and this much manpower and passion behind medical care and giving moms good care. We're still seeing this happen, and it just doesn't make sense. So advocacy is important because we can't leave things the way they are.
Thank you, Dr. Robbins.
I'll start next. Iris Lundy, very good to be here. Thank you all, and I certainly enjoyed you, Senator Locke. I think advocacy is important because we need the variety of voices that are in our community. And we need all of us coming together around a common goal so that we make a greater impact. We stand on the shoulders of giants, but sometimes giants need us to uphold their arms. And so while she's fighting, we have to fight. And how do we fight? It's all of us coming together to make our voices heard. Someone talked this morning about the importance of storytelling. That is so powerful. So how do we get our message out? We tell our collective story, and we don't back down on that. And we tell our children and our children's children that story. That is what makes us so strong, so unique, and so powerful together.
And the reason we were able to get bipartisan support on those pieces of legislation and to make them veto-proof was because we said to many other folks who were coming to see us, why are you coming to see me? I'm on board. The person you need to go see is so-and-so and so-and-so, and talk to them about these issues. I mean, I'm already convinced that this is a problem. You need to go see delegates and give them the name, where their office is. That's who you need to talk to, not me. I'm here. And that's what helped in terms of getting people convinced why this legislation was important.
I agree with all of that. I'm Hamilton Holloway with Families Forward, and I agree with all of that. And I'll say, if no other practical reason, then just like any business, that you have to constantly advertise and talk about and explain why this is important for your service or anything like that. It's the same with advocacy. You really have to continue to reiterate and reinforce why this is important and what's happening there. And Senator Locke is right on there. Anytime you can talk to her and find out who you're supposed to be talking to, then you're doing the right thing, because she's going to tell you who the ones who are going to be the roadblocks, and they're the ones that you go in and have those conversations and that story with about what's really happening to you and to your families and to your community. So that's where the change happens.
Dee forgot about me. I'm Benita. I'm sorry, Dee, I'm kidding. Advocacy is important because it saves lives. Advocacy brings awareness, and it keeps, just like Hamilton is saying, it keeps an issue at your front door where you can't ignore it. Advocacy is the long game. We're not in this for one brief moment. This conference is not it, right? We're not just doing this to have fun and join together for today. No, BEMA does the long game. 2.5 years of work got us here. And this introduces y'all to the work that we're doing moving forward, for us to work on this for a 3-year plan to hopefully continue it long term. Like, that's advocacy. Advocacy is being aware that unless people know that there's an issue and how to address the issue, they don't care. And they have absolutely no tools of being able to help the village work on it. And so advocacy says, we're gonna be present. Here's the tools that we're currently doing. Do you have feedback for that? And keeping it in their front door so they can't ignore it. I think the biggest issue we're seeing is that there's a lot of people making decisions for us who have no interaction with us. They have never stood and walked beside us. And so where most of us have walked beside or working with or have direct experience with what is going on, this crisis, there are plenty of people who just do not, for lack of access, because they don't want to, because they can. I minored in African American studies. I've learned a lot just from that, but that was a choice that I made. It was me choosing to do that. So that, of course, ignited a passion in me, but everybody's not doing that. Some people majored in, I don't know, earth science, and they're just so far removed from this. But it's so far removed from this that it's just not in their prayer view, and they're living their own lives. So advocacy says, hey, this is an issue. Hey, this affects you too. One of the reasons why when we started BEMA, we chose it initially had started off as for women of color. They had already kind of met that need. And when we revamped our alliance, we made it a point to work on Black people. We said, no, we're not going to do people of color. We're not going to do women. It's Black maternal health care. And that's not because nobody else matters. It's because we know, based off of everything else, history has taught us, if you focus on everybody else, Black people will never receive the benefits. But if you focus on Black people, everybody receives the benefits. Advocacy says that, so that's why it's important.
Thank you. Thank you. And in case you didn't know what BEMA stands for, Black Maternal Health Equity Alliance, Action Alliance. Just so you know, but BEMA is a lot easier to say. So this one is for Miss Lundy. What strategies, I know we talked about storytelling, but what strategies are most important for Black families, their support people, and community advocates in communicating and making change for safer Black birthing experiences? So any other strategies for families or support people or community advocates to make it a safer birthing experience for Black families?
Yeah, so for those who have been here all day, I think you've heard that over and over. And one thing I keep hearing about is a birthing plan. Now, when I was having babies, nobody told me about a birthing plan. You showed up, you did what you did, you hope it went well, and that's it. Now they're like, oh no, you can, like, I didn't even know the term doula. I just knew auntie and grandma and mama and them, but they were our doulas, right? And sometimes I think we just got to step back and do some of the things that brought us where we are. Even in healthcare, I look around and Destiny Flanagan, who's amazing right here, she put together this PowerPoint for me about Black history one time. And I said, Destiny, did you notice that the things we're doing in healthcare now are things that were started by Black people back in the day because we didn't have those resources? We're going to have to do the same thing now. Some of the things that were done for us, you need to do that. So yes, storytelling is important because one, if we don't know our history, we can't learn. And that goes with medical history too. So that's important. Birthing plan, get a plan. Know what it is you want to do and begin to talk to your siblings, your friends, your daughters. They need to understand this, right? And what does that mean? And look, there is power in your voice. If someone is not treating you right, and I don't care whether it's a physician, clinician, boyfriend, girlfriend, whatever, they're not treating you right, you have every right to move on. I don't know where we get this thing from that I have to stay with this person just because this is the only thing. No. Doc not treating you right, go to another doc. Matter of fact, if you need a doc, I have a recommendation for you right here. Like, honestly, like if you need, I get calls all the time. Who's a doc that I can see? Now I can add Dr. Judy to my list, right? But Dr. Robbins, yeah, man, she rocks. So I think know who the providers are. Start calling your other people in the community and say, who can I turn to? Who can I trust, right? And then as you're learning stuff, Senator Locke can only do so much, but she needs to hear from us about where we stand. And then when she's out there fighting, again, we need to support her while she's doing that. I think that's so important because we put a lot on people's shoulders and then we don't show up at the places we need to show up at, voting and other places, right? To make sure our voice is heard so that laws and everything else can get passed. So those are my thoughts.
Excellent. Thank you. Thank you. The next question is for Dr. Robbins, and it's tell us about the value of working collaboratively with your provider, since you are a provider, so that you can work together as a team with support, birthing support persons.
I mean, I think there's just in any area, tons of value in working as a collaborative team, but that applies to the patient and provider relationship too. The more you work collaboratively, the more you can have a plan that actually works for the patient, right? I mean, I can spout the guidelines and the national recommendations and the textbook answer all day long. But that doesn't work for everybody. And so the more a patient can say, I can't do that because of X, Y, and Z, then we can come up with a plan B together, right? It may not fit the textbook, but a plan B is better than no plan at all. And so if we can come up with that together through a conversation, then I think we wind up in a better place, and that builds trust so that when all the birth plans go out the window, which they sometimes do, because babies have minds of their own, we have that trusting relationship, and you believe in your team to make the right decision in the moment. And so I think that collaborative relationship would restore trust between patients and the medical system. That's a theme I've kind of felt throughout the day, is there's just there's some distrust there. And so I think we need to rebuild that through collaboration with our patients and other members of the medical team.
In our last session about the importance of bringing everyone together and how great it would be to have doulas and OBs and the neonatologists and pediatricians to all come together around one birth and to make it successful. And that's, I guess, a dream that we can have. So question for Benita, as we know that you are a home visitor. How might support people like doulas or home visitors or lactation consultants and community organizations best support safe Black birth?
The first is being intentional with your education. I mentioned in one of the panels is that when I gave birth to my son, I had some issues with lactation. And unfortunately, because of how networking has existed and is luckily improving, my home visitor didn't really know where to direct me. And I mean, she was my advocate. She was very encouraging, but she really didn't know how to get help, especially during the pandemic. I gave birth during the pandemic. It was a horrible experience. Giving birth, not the birth experience was fine, but it just was that kind of aftercare there was gaps. And I think because of that, when I started working a year later for Healthy Families, it was one of those things that brought me to working with this workforce, and BEMA in the first place is to advocate and push for us to be connected and work on networking and getting educated. And so our discussions have been trainings and making them more accessible and really trying to see what's currently the education for providers, community providers specifically, looking like. What's available? What are they learning? How are they networking? How are they connecting? What we learned is that most people are reconnecting because a lot of people left during the pandemic. But we had to be intentional about that. We had to say, where are the gaps? Do we have a lactation consultant working for our program? Who will we refer? What did I use? I luckily had a friend at that time who literally Googled how to connect me with a lactation consulting firm. And guess what? Now that person's on my resource list. Now I also have other people that I can connect to the resource, and they're looking for support. I know who to reach out. So I think education first, like being intentional about who and what is available and how to stay connected to them, and making sure we don't gatekeep that information. And share it. Like I will of course talk about my home visiting program till the day I die, right? But I'm also going to tell you that there are 6 other programs that exist that might meet your needs, and within Norfolk, they should all be at capacity, okay? Because there's just that many needs here. So that's what we're going to do, and I think that that's the first step.
Excellent. Thank you. We've heard a lot about the resources today and the importance of being connected. So moving a little bit more into laws and policy, this is for Hamilton. How might laws and policies help or hurt Black families as they navigate their birthing journey? And I'm going to just add another question, and you can pick what speaks to you. But what are the best ways to advocate when you don't agree with a law or a policy that's being considered or has been put in motion? So either one of those.
Well, on the first part of that, I think that oftentimes there are both unintended and intended consequences of laws and policies that can be very damaging for families, right? There are oftentimes policies that are put in place that have the best intentions and certainly look good on paper, but when they're implemented and you see how it actually works in the community, it is horrible, right? And you can see the difficulties that it creates for families, for access to services, things like that. There are other laws and policies that are put in place specifically to cause that difficulty. And that's where it is so important on both cases to not just raise your own voice, but help everyone in your community to share that voice and understand why it's so important to change that or redefine it or have it reworked or understand what the consequences are for this, both short-term and long-term. And that's that is an ongoing battle because I think it's always a case of, you know, we'll see what came out of the General Assembly this time, right? That there are going to be things that are put in place where there's going to be consequences that come out of that we did not realize were going to happen. And there may be easy fixes for that, but it's urgent that we jump on it right away. And that's where advocacy comes in to say, hey, gosh, we are seeing right on the front lines, we are seeing in home visiting, we are seeing in doula services on the front lines, that this policy that we put in place that was supposed to help us really isn't. And here's what we can do, or here's what you, legislator, can help us do to change this or get this right, or to work with, for lack of a better term, a policy wonk, you know, at one of the state departments, right, to understand what those little definitions are that can be changed and redefined so that the intended outcomes or the positive outcomes of that are put in place. I think that's one of the biggest challenges is jump on that as quickly as possible. What was the second? Yeah, right. Oh yeah, she's gonna jump right in. She's gonna set me straight on what I just said. So listen to her, what she said. I just laid it out. She's gonna correct me on this, and we're gonna all learn right here. So.
Now, I don't know how many of you remember, it's been a while back when Virginia passed this law on transvaginal ultrasounds, and that landed us on Saturday Night Live. And it's that kind of legislation that we don't need because we don't want to become the laughingstock of the nation. And we did become that because of that legislation. And the best thing to do is when you hear of legislation that you know is bad, the best thing to do is to get yourself in your vehicle. You don't have to now because you can do it virtually, and testify. You know, and testify against it. And you have your notes, your rationale for why you think that this is not good public policy, why you think it is bad. You know, have your data against that policy. And believe it or not, folks are going to listen. If they're a committee chair like me, they're going to time you. But at the same time, you know, I think that you can put your information within those time frames, usually 3 minutes, you know, and give folks good reasons for why this is bad policy.
Give an example of a law with good intentions but bad outcomes, just so we can all train our ears on like what to look out for. So a while back, women, I'm sure everybody knows, were sometimes being sterilized against their will. They were having surgeries they weren't consented for. They didn't understand what was happening. So in order to protect women from that happening, Medicaid laws were passed to require that Medicaid patients sign, we call it a BTL form, a sterilization consent form, 30 days before their delivery. Sounds great, right? We're going to make women like get good counseling, hear the risks and benefits, understand the alternative forms of birth control, have an opportunity to tell them that like you don't have to do this if you don't want to, and then they sign that form and it's well in advance of their delivery so they have time to think about it. Sounds so good, right? But what has happened is that that form now is leading to women with Medicaid not being able to get their tubes tied at the time of delivery when they want it. So now we can't offer permanent contraception to moms who are literally begging for it. And I take care of patients all the time who are like, I didn't sign my form in time. That's why I'm pregnant again. Or I didn't know about the form. Not that I'm not putting the onus on them. They just didn't have the opportunity to sign it. So that's an example of like a good intention that just played out very poorly. So as you're hearing about these bills and things, please think about it through the patient lens, because that's a perspective that we don't always have. So your voice is really important.
Thank you for that. And I'm wondering, just because Senator Locke introduced so many of the different bills, some successful and some not, I'd love to just hear from anyone else if they have strong feelings. I'm wondering, Hamilton, if there's any that like you were, wanted to weigh in on, or any wins or
I think that's part of what Benita was talking about, the long game on advocacy and all, is that it's so easy to get disenfranchised or down on the short term when specifically with Virginia's General Assembly, with such short sessions and so many bills are put into play that, and every one of them for the constituents behind those bills, it's the most important thing. And so, it's that fight of understanding that there's that many bills, and the reality of your bill getting through, or the issue that you want to get across getting through, is very slim, and it takes so much effort to not give up after, if it doesn't pass the first time through the General Assembly, for instance, to not give up if it's that important, if it's important to get done for your families, for your children that you serve, then don't give up on that. Continue that longer fight. Yes, take a few days and take a breath and get that energy back again, but realize it's going to continue on, and there's going to be another fight on other things that you've got to do. And so I think that's one of the hardest things, is to keep that momentum, particularly with coalitions and groups that are around one big issue. If it fails one time, keeping that momentum going is probably the biggest challenge right out of the gate after it fails, to come back around again.
I have to reiterate that point, because some people will simply say, oh, my bill died, and okay, oh, well. No, bring it back again. I mean, I've been doing the unconscious bias bill for how many years now, Catherine? 5. And I'm pretty sure the governor's going to veto it this time too. It'll be back in 2026, and he'll be gone. So my chances are good.
And I will say, they do it very nicely, right? They say, I'm laying the bill gently on the table.
We don't do that in the Senate. We're not gentle.
Right.
This is great. I think we have, 15 or less minutes. And so I want to give everyone a chance to have, the microphone. And then maybe we'll have time for other questions from the audience. So just sort of a kind of a final thought. What's the one most important thing that you want to leave our audience with today when thinking about how we all stand to protect Black maternity? So what's the one sort of most important thing, if nothing else, that we can take away today, so that we are all standing to protect Black maternity? Who wants to start?
I made a list. First and foremost, empower yourselves, because you can be your most important advocate for what it is that you want and what it is that you need, because you are a fierce advocate for women's health care. And you can help others understand that a healthier Black mother and a healthier Black child means a healthier community overall. Yeah. And you can be the change.
It is so easy to feel like we are standing alone, but I need you to understand you, me, us. We're never alone. We're always standing, whether it's our ancestors that are standing with us or those in this room. And that probably sounds a little cliche-ish, but it's not, because there are some rooms when you walk in it, you may be the only one standing for that particular thing that you believe in. So you have to believe that everyone that has come before you and who will come after you are standing with you. That takes me into a lot of rooms.
I think I just want to encourage everyone to not lose heart. I know that I think that it's taken us about over 400 years to build a society where these outcomes are even possible. And so there are a lot of historical forces that are still rippling through. And that's where institutional and systemic racism come into play. And I think that it's taken a long time to get here. It's going to take some time to dig out of the mess that we've made. So even if we're not seeing numbers getting better, month over month or week over week, year over year, I think progress is being made. In the big picture, this room proves that to me. The conversations today prove that to me. And I do think we're making progress. So let's all just keep our foot on the gas and charge through these next few years where funding might get tight and we might meet some new obstacles from a regulatory and statutory standpoint. But I think that together we can continue to make progress in the right direction.
I guess, I could say, everybody get home visiting. I'm not going to do it again. I think the biggest thing, is I want people to know that Black families deserve to feel safe and served and cared for in their birth experience. Like, we deserve it. I think anybody that makes you feel like you doesn't need to be involved in your experience, and they need to get their own education. I think we have lived in a society that has told us that we deserve less because we get less, or that we think less, or whatever. We are here. We are stronger together. We deserve to feel safe. We deserve to be safe, and we deserve to be saved. So I think that is what I want people to know, that like, we're not in this alone. And I've told families when I work with them, and I tell them that, like, if somebody is choosing to be a part of your village, then they are taking a responsibility for you, especially as a mom. Like, you cannot parent alone. Like that old saying, it takes a village to raise a child. It really does, though. And if you're choosing to be a part of my village, you got to know who I am as a person and that my needs are valid. And so if you're choosing to be here, be here. And you have the right to say, I need you to be here, because I can't show up in the way that I probably could, like if I was Superwoman. I'm not Superwoman. I'm a human with emotions and kids and relationships and work and stress and mental health diseases or whatever. Hey, be here. Show up for me. Ask how I am doing. Check in on me. You deserve it. You need it. It is a requirement to be here. And if they cannot, for whatever reason, that's okay. But you don't expect me to be okay if you can't be here for me. So that's my thing.
And I just said, I'm happy to say that she can say that you try home visiting. Absolutely. I'll reiterate what Senator Locke said is get your story, hone your story, hone your ask. And then secondarily, just like you're on an airplane and you're getting those instructions, you've got your mask on first, you've got your story. Now help the families that you serve, the children you work with, find their stories and empower them to share their stories, and why sharing their stories is so important for policymakers, for legislators, for corporations that are changing their minds right now of what they believe they focus on, why it's so important for us, for all of us, to be a part of this community together. And I think that also there are people in here who, for instance, there's different home visiting programs here today that are in nonprofit, and there are some that are in local government entities, right? And so local government entity person may not be able to go to Advocacy Day at the General Assembly because they're not allowed to because of local policy, right? But they can still empower their families. They can help their families get to the General Assembly and share their stories as well. So everyone can still have a role in sharing those stories. I think that's as important as anything else. And the what Benita was saying here about empowerment in our communities is that in spite of feeling like right now that the ground is just shifting and rattling away under us, the focus on family and whatever that means to each person is the start of a conversation that we can have with anyone, no matter where they stand on what side of the aisle, and about children and about the safety and what we want for our communities. That's where we can start those conversations beyond that, well, you said this and I said this, to get away from that and talk about, we're talking about your family and my family and your family and your family. And that's where those conversations can move what we're being pushed against right now.
So I think there's maybe about 4 minutes, and we have such knowledge up here. I want to take us up to the last minute. So question.
I don't have so much of a question as a comment. Our legislators are out here fighting. And the one thing that we can do is support our legislators when this is an election year. Vote for them. Keep them in place. Support them. Ride for them the way that they ride for us. Because it's so important. People think, oh, well, let me think about voting for the president or whoever. It's our General Assembly members that dictate what's happening with us. So support them the way that they support us. Thank you.
And even our city council members, take it even down to more local level.
I wanted so one thing I've been doing lobbying around to increase access to midwives in 3 different states and DC. So I'm very familiar with the dynamics of it, and that it is often a nonpartisan issue because the physicians stop the conversation. And what is different in Virginia this year is that the Black Maternal Health Caucus with Senator Locke and others probably said, I didn't see this part, but like, doctors, you're gonna sit over there for a second, and did something that I have never seen before. So my question is for Dr. Robbins, because I was here this Monday, a couple days ago, and I heard Dr. Uche Blackstock fight for midwives. And I said, I rarely hear physicians say what you just said. And if every physician said that, every woman, birthing person would have access to a midwife. She said she pays a price for speaking the way she does. So my question to you as a physician, how do we normalize, how do we have the boldness of Senator Locke and the Black Maternal Health Caucus to say, no, we have a system that needs to change. We need to think midwives, right, for normal birth and the team approach. How do we get there?
Yeah, great question. So my sister is a midwife and a family nurse practitioner, and I'm a high-risk obstetrician. And so we both love growing families, and we talk about it a lot. And we talk about how our fields are similar and how they're different, and sometimes we fight about it. And sometimes it's, but we always grow from it. But it's always a lively conversation filled with passion because we both love what we do. I'm so in awe of what she does and what other midwives do. I trained with midwives in residency and learned so much from them, and I owe them a huge debt of gratitude. And then I've trained with maternal fetal medicine docs, one of whom calls herself a maternal fetal midwife because she likes to meet in the middle. So I do try to, I think that there is a great role for all of these birthing professionals in the field. And what we need to do is identify which patients are best for which path. So if we can safely direct patients into the right model of care for them and keep them safe in birth and start babies' lives off on the strongest footing possible by better identifying who's right for which track and which birthing location. And then, as we discussed in the earlier, in Dr. Wardlaw's talk about smoothing the transition so there's not such a silo between our home birthing populations, birth centers, which I don't feel like we see quite as much of here as I've seen in other communities, and then hospital births. If we can smooth those transitions, then that makes it safer overall. But right now, while we have these barriers, and I think it's a tricky field to navigate in our current community as it currently stands. So we definitely have room for improvement in terms of the triaging of patients and communication between the different birthing professionals and sites in our state.
Thank you. I think one more comment and then we'll bring it to a close.
I think the other thing we have to do is make sure our hospital leaders are carrying that same message. Yes, we need the physicians, but we need the hospital leaders too. And our leaders are starting to do something different around that, like in Fairplex Hospital on the other side, there are midwives there. We have doulas now in the Williamsburg Hospital going into the operating room. They get us Centera badge. We have to change that culture, but we need leaders working alongside the physicians to change it. And I just want to make sure that we call that piece out.
Yes, thank you. Thanks for landing us on a really positive note. Thank you all for your time today and your knowledge, and thank you all for being such a good audience.
Thank you. I want to thank the panel. This was amazing. We are so fortunate to have such brilliant people that we work with and such passionate people that we work with, and people that are willing to go the extra mile to have these conversations and, more importantly, move to action. And so one of the really important things about when we went through a new strategic planning process for what became the Black Maternal Health Equity Action Alliance from our prior work, the key piece in that was action. We have a community action plan that's on our website. The link is in your booklet, I think on the page that describes the Black Maternal Health Equity Action Alliance. We have a lot of very powerful, wonderful, passionate advocates that are working with us across all of our programming. Take a look at our action plan. Find a place for yourself in it. If you have transportation challenges, that's okay. We usually meet via Zoom. We have a place for you in that action. So I just wanted to kind of say across the day, we've heard all kinds of different things. A big theme has been voices, which is also something that the Action Alliance is very passionate about. We have two projects, like I said before, both our interview process and our survey process, talking with women who've given birth in our area in the last 3 years to better understand their experiences. Next year for Black Maternal Health Week, we're going to be doing the AMCC Maternal Monologues, where we're going to be hearing stories from families. And so we want to keep those voices at the forefront. We want voices to be heard by using technology like the Earth app. We don't own it. We found it. We've partnered with them. It's not being used here, and it's a great tool. So really be thinking through, as we think through all of these conversations today, and I'm excited about trying to get the links to all the recordings for the breakouts that I missed. But thinking through all of these conversations that we had, implicit bias, the importance of support people, the importance of dads and their roles in how we advocate for Black safe Black birth. All of these things, and thinking through like the roles of midwives and doulas and all these other pieces, comorbidities, everything that kind of comes together. It's so important. And so I just want you guys to leave here. A lot of times we attend these things and we are amazed and we're overwhelmed and we leave and we kind of don't act on things. So find at least one thing about something you heard today, saw today, talk with somebody else about today. Find one thing that within the next week that you personally will take action on. Can everybody commit to that in this room? Can everybody commit to that? We're going to all do at least one thing about this work in the next week, whether that's joining an action team with us, whether that's joining another group, whether that's making a call to your legislator, whether that's having a hard conversation with your own doctor, any of these things, okay? So I want to welcome up some of our Black Maternal Health Equity Action Alliance leaders. And I also want to just take a minute to say, if you are on the Black Maternal Health Equity Action Alliance, whether you just attend our quarterly consortium meetings, whether you are on an action team, if you are a part of us in any way, can you just stand up for a second? So this work is your work, so we thank you. And then I also just wanted to say, if you are on the conference planning team, please stand up. And Deb's our other co-leader with Teresita over here. Kelsey, huge help. I see Courtney. Everybody has been such an important piece. Dr. Burwell, Dr. Ward here at NSU, Benita and Takima, and everybody who's been working on this. Rachel has just been such a big piece of how we've been able to be successful in bringing this together. So we really wanted to say a thank you to you guys and how important it's been, as well as bringing in sponsors to make this happen. This kind of conference doesn't happen without some commitment, sometimes with some cold hard cash. So Melina and Centera and Norfolk State have been instrumental in being able to fund this specific conference. We also have other funding from the Brock Institute at EVMS as well that provides some other supports for a lot of the other work that you've seen that we've talked about today. So I just wanted to say thank you and be ready to take action. And I want to give Teresita and Takima and Rachel a chance just to make a quick comment about how things have gone and what the future is next.
That's so wonderful. Thank you, Amy. I just want to say from this conference, I've learned that everybody deserves to be seen, heard, and believed. And it takes a village. So if you are not connected, you're not plugged in, find me. I will find you and plug you in. You can ask many of these people in here. I will find you and plug you in, but it takes all of us, and we cannot change the whole world, but we can change this Hampton Roads area. There's enough people here, we can get it done.
I didn't necessarily come up here for remarks. I had to, I had to make a comment about the CNEs, but while I have the mic, I do want to just give a huge, huge, huge thank you to Norfolk State University, specifically Dr. Sheila Ward and Cynthia Burwell. I have been working with them since I graduated back in 2012, and we were in crisis and needed somewhere to host this. And I sent Miss Sheila a text, and I was just like, ... I got to ask you for a favor. And they made it happen for us. They allowed us to come into their space, and I am so totally grateful. I can't express, when we have conversations like this, we need to loop in our HBCU partners. There's no reason why we talk about Black health, and they're educating our next Black providers. So we really need to loop in our HBCUs as we do this. But I will give my quick CNE message. If you're getting CNEs and you're online and you're in person, I do need that pre and post test. You do have to pass it. You do have to get an 80% or more. For those online, we will verify your attendance. So you won't get it if you didn't fully attend. So there were pre and post tests that were given out throughout the day, but our online folks have it too. And so please make sure that I get it, or at least goes on that back table before we leave, so I can make sure that you get your certificate before you leave.
Well, I told everybody from the beginning, I'm not the speaker, Benita's the speaker. But I just want to thank everybody for all your hard work, everybody behind the scenes. We have worked, we have got here, we have made it happen, and we're going to have to do it again. That's it. And I appreciate everybody. You guys online, you guys here, IT, all the volunteers, everyone, Norfolk State, everybody. Senator Locke, thank you for coming down. Iris, Dr. Robbins, Mr. Hamilton, Benita, you hold it down for us. You hold it down for us. All of the speakers, I thank everybody. We really, 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 really appreciate all of your hard work, dedication. Amy, thank you. Thank you, thank you, thank you. You have held us together. We did it. Teresita, you can make me cry. We got it. We did it. It's done. And we're going to keep going. Rachel, you held it down for us, Rachel. You held it down for us. And Kelsey, I'm not going to forget about you, big dog. Thank you so much to everybody. Thank you. Thank you, guys. You guys just don't understand how much this means to us. And that's it, because I'll start crying all over the place. Yes. See, told y'all she was the speaker.
No. After she gets a whole speech talking about I'm the speaker now, you know, I try. Anywho, I just wanted to say real quick before Deb gets on the mic, Deb graduates with her RN today. And when I tell you, my girl is a mother of two. She is a full-time doula, owns a business, is a full wife who clearly supports her husband. And she is just an overall awesome person and is out here finishing her nursing degree. When I tell you, like, and doing this. Like, I couldn't let the day go by. I planned on doing this no matter what. It's a big deal. And looks good. Come on now. Like, she's still here. Her tail needs to go. So I don't want to hold the mic because she literally has her graduation today. But like, we're so proud of you, Deb. Like, y'all, Deb has been a part of BEMA. I think you started with the conference mainly. And so last summer we started planning for this conference, and it started with me, Teresita, and I was just like observing. Me, Teresita, and Deb and somebody else who was not able to continue on with us. It was just four of us in our little teams meetings, and Teresita was over here planning. I mean, Teresita thing planned by the next Monday. We met on like a Thursday, and she had it planned by the next Monday. And ever since then, when Teresita says that she is connected everybody to this conference group, it would not be happening if it was not for Teresita's diligence and passion for this. And I mean, Rachel wouldn't even be here for it. Like, and it happened so easily. One that speaks to who Teresita is as a person, because everybody that got connected to this conference had no issues. Like, the team that we had, everybody that was connected was intentional and passionate and cared. Like, this has been a beautiful, like, when I say 2.5 years and you see this is our first fruits, I'm just so proud and thankful for y'all. Like, to get to know y'all and be connected. I remember when I started my job, I always said, like, I don't want to be nobody's program manager, director. I don't want to supervise nobody, but put me in the room with people who are making decisions for my community. I did not start my education for no other reason but to be doing the work like this. Like, I care about my community. And when I see that we're in crisis, from housing to maternal care, I gotta be involved. I gotta be here. And so I'm grateful to see so many like-minded people in a room, sharing space, being able to have and coordinate with. It's like a beautiful thing. And our legislators, when I tell y'all, when you learn about legislation, as you learn and you grow and you see how many people really care, the work is being done and we can do so much more. And so I'm grateful. I'm thankful. I ain't gonna cry though, because I didn't have my little, I'm just so thankful for y'all. Congratulations. Thank you, thank you, thank you. Thank you, thank you, thank you.
Have much to say, But again, thank you all for coming. Thank you for all the panelists, the speakers. Big shout outs to the media guy, Russell, because, you know, you've been a big help. I just hope that everybody either learned something or took some information to enhance their services that they provide or can share with the community. So take that with you and continue to do this much needed work. I hope you all have a great day, a great evening, should I say, and, you know, be well.